Hi, I'm Dr. Suriya from Polyclinic, Qusais, and I'm here to talk about the novel coronavirus. We have encountered the novel coronavirus in the Wuhan province of China during the outbreak last year, 2019. The novel coronavirus is part of a family of viruses called coronaviruses. Coronaviruses are transmitted from animals to human beings. And we have recently encountered this in the form of MERS-CoV as well as SARS-CoV, and they can cause respiratory illnesses ranging from something as small as common cold to something as serious as pneumonia and respiratory distress. The novel coronavirus is transmitted from animals who are infected to humans, and also there is human to human transmission. The transmission of coronaviruses can happen in two ways. One is through droplets, and second is through sharing of surfaces that is contaminated. So if you were to touch a surface that is contaminated by this virus and then touch your face, the virus can easily enter your respiratory tract and cause an infection. Presently, there are two groups of people who are at risk of contracting the novel coronavirus. The first group is people who are handling live animals who carry these viruses. It can mean the people who are working in the live animal market. And the second group of people are the ones who are caring for the people who are infected with the virus. So this can be your family members who's taking care of you in case you have the virus, or it can also be the healthcare workers who take care of these people who are having the infection. The symptoms of novel coronavirus can be mild or severe. The mild one is fever, cough, shortness of breath, and breathing difficulties. The severe symptoms may include pneumonia, kidney failure, severe acute respiratory distress syndrome, and maybe even may cause death. The diagnosis of the novel coronavirus firstly happens in the clinical setting. In case if you are experiencing any of the symptoms that I have mentioned before, and if you have a history of travel to the Wuhan province of China or coming in contact with somebody who is suffering from the illness, in that case you can go forward with the lab diagnosis, which includes polymerase chain reaction or PCR test. There is no specific treatment that is aimed towards the novel coronavirus at the moment, and all the treatment that is available is for the symptoms. So if you're having a fever or a cough, we can give you the medications for that, and if you're finding it difficult to breathe, we can put you on a ventilator. The good news is that vaccines and medications aimed towards this virus is under development and will be available soon. The recommendations to prevent the spread of novel coronavirus includes regular hand washing, and if soap and clean water is not available, then using an alcohol-based hand sanitizer. Covering mouth and nose when coughing and sneezing with a mask or a tissue or a flexed elbow. Proper use of masks and personal protective equipment, especially in a healthcare setting. Avoid close contact with anyone showing symptoms of respiratory illness, such as coughing and sneezing. Preventing transmission from animals, including avoiding unnecessary contact with live animals and eating well-cooked meat and egg only. And if you have been diagnosed, it is advisable to stay home after starting treatment in order to prevent further transmission. If you're suffering from a cough, cold, body pain, or is having difficulty breathing, and you have a history for any of these two. One is that you traveled to a place where there's an outbreak of the novel coronavirus, and two, if you are in contact with somebody who is infected. If you have both the symptoms and a positive history for this, then you may proceed to your nearest healthcare provider. But before you do so, there are some things that you have to bear in your mind. So if you have decided to meet your healthcare provider, the first thing you should do is make a call to them and inform them that you are going to be there at their facility. This will give them enough time to prepare a room for examining you and starting your treatment. And this will also prevent the further transmission of the infection that you might be having to other patients. And please be sure to wear a mask before you leave your home. Since there is a lot of false information going on about the novel coronavirus in the social media, I hope this video brings you clarity and there is nothing to be worried about. This video is aimed at creating awareness and not anxiety. So hope this helps. Thank you.